lighter color. So multiple sclerosis can be present at any age with a mean age of onset between 25 to 29 for relapsing remitting, 39 to 41 for primary progressive, and almost 10% cases are present before the age of 18. Okay, so as we were talking about Europeans, so the overall prevalence is cited as 1 in 1000 of population for like European ancestry. Okay, lesser in non-European. Okay, yeah. So this is like the basic of epidemiology, which is not that important, but yeah, now pathophysiology, very important. So the pathophysiology of multiple sclerosis primarily affects the CNS and involves various areas such as like the cortical gray matter, periventricular and juxtacorticular white matter, optic nerves, spinal cord, cerebellum and meninges. As we were talking about the areas, focal, whatever the lesions, wherever the plague are depositing and causing that area to go off, So this is like the basic fundamental pathology behind. If we see like this is a very common presentation in multiple sclerosis. This is like optic neuritis as an indicator of multiple sclerosis. We can see the damage going on, the degeneration of the optic nerve, here. You can see this, this area. So yeah, this is the fundal view of the degeneration going in optic. Is case of optic neuritis in multiple sclerosis, going in multiple sclerosis. Okay, yeah, one sec. Yeah, the two fundamental processes that constitute general pathological processes observed in multiple sclerosis involve the focal inflammation resulting in macroscopic plagues and injury to the blood-brain barrier. Okay, I was referring to the term plagues so many times, and we have discussed this injury to the blood-brain barrier very nicely. So now you know the focal inflammation. This color is not great here. The focal inflammation resulting in macroscopic plagues and injury to the blood-brain barrier. First fundamental, and the second is neurodegeneration involving the microscopic damage to the various components of CNS such as axons, neurons and synapses. We have also discussed this, like the two basics of it, two fundamental. Yeah, and you should always remember the two fundamentals. So that together, these two primary, the primary processes results in a macroscopic and microscopic picture of the injury, and the lesions called plagues occur in waves throughout the disease and result in from like the focal inflammation. So these plagues predominantly center around the small vessels and venules, displaying sharp margins. The chief component of the plague pathology include the myelin loss, the edema, swelling and the axonal injury. We have discussed it very nicely, right? So that during the active plague inflammation, disruption of blood-brain barrier occurs, considering to the enhancement observed on MRI scans. We'll see the MRI scan. Okay, we'll see the image showing the perivascular plagues in multiple sclerosis as seen in the MRI. Okay, let's see this picture first. Yeah, so periventricular plagues. Okay, like yeah. So here you see the MRI first. Okay, what can you see? Just see through the ventricles. Okay, these, these, these. So the periventricular plagues in multiple sclerosis, it is seen, which relatively decreased perivascular inflammation compared to the active plagues. This is the picture of perivascular plagues in multiple sclerosis, what we were talking about. So the microscopically multiple sclerosis lesions show a mononuclear infiltrates with perivenular cuffing and infiltration surrounding the white matter. Okay, now the innate immunity on such as like from the monocytes and macrophages stimulate the T cell migration across the blood-brain barrier, resulting in blood-brain barrier injury and systemic immune cell infiltration. We have discussed it through very systematic pictures, so we will skip this all part, and we have already discussed it. Okay, this is all mentioned, and yeah, obviously it will ultimately lead to demyelination, neuroaxonal degeneration, loss of sinuses, dying back, oligodendrogliopathy, tissue injury, and astrogliosis. Okay, the damage, whatever it is, resulting due to that perforations and degeneration. Okay, now the histopath. So obviously it is characterized by plagues, है ना, due to inflammation and myelin breakdown, neurodegeneration, oligodendrocyte. The terms are keeping repeating because these are like very important terms. Okay, we can't skip it. If we are talking about multiple sclerosis, there is degeneration, there is immunity involved, and obviously everywhere there will be breakdown, degeneration, destruction. All we'll talk about as this in multiple